Ah. Good morning all. My humble and sincere thanks to Tamilnadu Physical Education Sports University Vice Chancellor Sheila Stephen Ma'am and Yoga HOD Dr. Selvalakshmi Ma'am, our beloved Dr. Durai Sami and my mentor, philosopher, guide. He is none other than our former HOD, Dr. Nirangovan sir. Without his mentor and guidance, I am not in a position to take class today. Sir, thank you very much all my professors, my dear students, for this golden opportunity. So today is the 7th International Yoga Day and the theme is Yoga for Well-being. So now let us start with the prayer. Om Sahana Bhavatu Sahanau Bhunaktu Sahaviryam Karavavahai Tejasvinavadhitamastu Ma Vidvishavahai. Om Shanti Shanti Shanti. I'll give a brief introduction about yoga. See, yoga, what it means. Does yoga belongs to only old and orthodox people? No, it is not so. Yoga is something like going to the mountain or forest and doing tapas and not taking responsibility in the family and doing our duties. No, yoga is a way of life. It is one of the 6 Indian darshanas. Yoga is one of the unique gift by India to the entire mankind, humanity and the world. So yoga, the word comes from the Sanskrit word yuj, which means unite. See, now you know very well about the present COVID condition, why we are suffering very much. Actually, rather than see the severity of the COVID disease, so our mental fear and stress caused by so many unwanted information about COVID is causing this much of problem. Why we are affected by this? Because there is no balance or harmony between our mind, body, spirit and emotions. So yoga is the only tool which brings balance and harmony, and it synchronizes all our body, mind, thoughts, feelings, actions, even our behaviors. So we are fortunate enough to learn yoga. So this is the brief introduction about yoga. See, first let us start our sessions with the breathing exercise, which is the need of the hour. So first I will do hands in and out breathing. All of you please stand up. Stretch your arms. Let your palms touch. Inhale and extend your hands. Exhale and your palms together. Inhale. Exhale. Inhale and spread your hands apart. Exhale and keep your palms together. Inhale. Exhale. Inhale. Exhale. So this is hands in and out breathing. Next, hand stretch breathing. You please, all of you, interlock your fingers. Keep it near your chest. Extend your arm and do like this. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Now, at your forehead level, do the same thing with the interlocked fingers. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Now, next is you have to do interlocked fingers and keep your hands above your head. Inhale. Exhale. Even you can slightly raise your ankles. You can stand up on your toes and do. This is also known as ankle stretching. Inhale. Exhale. If possible, you can stretch your ankle, otherwise simply you can stand and do. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. See, because of this, now you have activated your lower part of the lung, middle part of the lung, and upper part of the lung. So these are all simple breathing exercises. Now let us go for loosening exercises. Okay? So all of you please stand and inhale and bend back. Exhale and bend forward. Do it 5 times. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. See, you have completed the backward and forward movement. Now, do the sideward movements. Keep your legs apart. Inhale and raise your hands. Exhale and bend right side. Again, inhale and come up. Exhale and bend towards your left side. Inhale, come up. Exhale and bend towards your right side. Inhale, come up. Exhale and bend towards your left side. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Okay, right. Now let's do jogging. Forward jogging, backward jogging, and sideways jogging. Come on. Forward jogging, next backward jogging, sideways jogging. So after doing this, just you bend and you do blast expiration through your mouth. This is called as Mukhadauti. So it releases more carbon dioxide from your body and it will keep you fresh. So we have completed backward bending, forward bending, sideward bendings, and also the jogging. Okay? Yeah. So after this, see, we have prepared, see why we have to do this loosening and breathing exercises. Breathing exercises will give you enough oxygen for your workouts. And the stretches, it will remove all your stiffness because most of you may have stiffness in the early morning. So these loosening exercises will remove all the stiffness. So now let us do Surya Namaskar. See, it is also known as self-salutation. Surya Namaskar is the perfect package because it has all asana, pranayama, meditation, and whatnot. It is even the beautiful medicine also. So don't worry, we are going to do only 3 rounds. First, I will explain. See, the Surya Namaskar, it activates all the system in our body. Circulatory system, respiratory system, nervous system, digestive system, excretory system, and also the endocrine system. So it's a perfect thing. Even if you don't have time to do 1 hour workouts, you can simply do this Surya Namaskar for 10 or 15 minutes, it will make your day. See, those who cannot do Surya Namaskar because they have arthritis, they cannot sit down and all. Even now the chair Surya Namaskars are all modified and it isn't. So now I will do the Surya Namaskar. So first I will explain the steps. First, Pranamasana. Next, Crescent Pirayasana. Third, Pada Hastasana, hand and foot posture. Fourth, Ashwa Sanchalasana, horse pose. Fifth, Dandasana. Sixth, rabbit pose. Shashankasana. Seventh, Shashtanga Namaskar. Eighth, Bhujangasana. Parvatasana, mountain pose. Again, rabbit pose. Now, right leg forward. Bring your another leg also forward, hand and foot. Slowly raise. Do the crescent or Parayasana and do the Namaskar. All of you, please get up. I will help you. Let us do only 3 rounds. All of you stand straight. Feel free. Legs slightly apart. Namaskar. Then do back bend. That is crescent Parayasana. Then bend forward. It is Padahastasana or hand and foot. Next, right leg backward. Horse pose. It is also known as Ashwasanchalasana. Next, bring your left leg backward and balance your body like Dandasana. Next, rabbit pose, Shashankasana. From rabbit, you do Shashtanga Namaskar. All parts of your body touch the ground. Next, do the Cobra pose, Bhujangasana. From Cobra, you do Parvatasana, the mountain pose. From the mountain pose, again you do Shashankasana, the rabbit pose. From rabbit, you do right leg forward, Ashwasanchalasana. Now you bring left leg forward, Padahastasana. Slowly get up, inhale and bend backward, Namaskarasana. Let us do 2 more rounds. I'll simply give the names as Namaskar like that. All of you please stand up, get ready. Namaskar, crescent, forward bend, horse pose, right leg backward, both legs backward, Dandasana, rabbit, Shashtanga Namaskar, Cobra, mountain, rabbit, right leg forward, horse pose, both legs forward, hand and foot pose, crescent, Namaskar. Only 1 more round. Again, all of you please stand at ease, legs apart. Namaskar, back bend, crescent, forward bend, hand and foot, right leg backward, horse, both legs backward, Dandal, rabbit, Shashtanga Namaskar, Cobra. While doing Cobra, your elbows should be bent. Mountain. Again, rabbit. Right leg forward. Both legs forward. Bend forward. Hand and foot or Padahastasana. Slowly inhale and come up. Bend backward. Crescent or Pirayasana or Ardha Chakrasana. Now, Namaskarasana. See why I have insisted doing this Surya Namaskar. See, the results are very good. If you do Surya Namaskar, really, I've taught the Surya Namaskar to many of these patients during COVID and they have got remarkable recovery. So their oxygen saturation really improved. And it will take care of all your, that is the constipation problem, digestive problem, arthritis. It elevates your mood and it reduces even anxiety, stress and depression. That is why I took this much of time to explain this Surya Namaskar. Okay? So all of you please lie down just for a minute because after Surya Namaskar, we have to lie down at least for 10 counts. All of you lie down in Savasana, close your eyes and feel the pulsations, sensations, vibrations in your body. Slowly get up. Let us go for asanas. See, most of us, we think that yoga means only asana. No, it is not so. See, even Westerners, now they are adapting yoga instead of doing exercises. They are thinking that yoga is also a form of exercise. No. Yoga is not only a physical form of exercise. There are a lot of difference between physical exercises and yoga. See, physical exercises, it will it needs a lot of equipment, a lot of space, a lot of time, money. But yoga, it doesn't need anything. Simply you need 6 feet space, and you don't need any instrument, or you don't have to spend money. The thing is, you have to spend your little time. You can do yoga anywhere you can do. Right? So asana means simply posture. Patanjali says sukham stiram asana. See, you shouldn't harm your body, that is ahimsa. You should do good to your body. So the asana must be steady, comfortable. So you can gradually increase. Suppose if you are unable to do some asanas, we can do modifications with the help of the props, thanks to our great yogi, Dr. B.K.'s Iyengar for that course. So now let us start standing asana. All of you please stand and let us do Tadasana, mountain pose or palm tree pose. So legs together, raise your hands, inhale and raise your hands, interlock your fingers and stretch your spine. Stretch your spine. It will relieve all your backache, neck, shoulder pain. It reduces fat. There is no contraindication for this. Anyone can do this simple asana. Now exhale and relax. So the counter pose of this Tadasana is Utkatasana. One secret of Utkatasana, Utkat means chair. See, you have to assume that there should be no chair, but you are sitting on the chair and do it. The importance of Utkatasana is, if you don't have time to go for walking, if you spend your time in Utkatasana for 1 minute, it is equivalent to 1 kilometer walking. If you spend 5 minutes, it is equivalent to walking for 5 kilometers. Even ladies, if they didn't find time while they are boiling their water or milk, even in the kitchen, they can do. See, such a wonderful asana is Utkatasana. Now let us do. All of you stand straight, legs together. Please stretch your arms forward, inhale, exhale and slowly bend your knees and assume that you are sitting on the chair. Now do normal breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Inhale and slowly come up. Exhale and bring your hands down. Let's do once again, because you are spending time now for 1 hour, so you may not find time to go for a walk. So let us make use of that. Legs together, stretch your hands, inhale, exhale and slowly bend your knees and adopt the chair position. Normal breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Inhale and slowly come up. Exhale and bring your hands down. See, the contraindications for Utkatasana is those who have undergone recent surgery in the stomach or knee joint or hip joint, and those who are having very severe arthritis. Otherwise, anyone can do. Even suppose if it is not possible, you can do even with the help of props, or you can balance with the help of some table, bench, like that. So this is Utkatasana. So we have completed, that is upward and downward. So both are complementary, Tadasana and Utkatasana. And now let us do the side pose. That is, it is nothing but Ardha Kati Chakrasana. Ardha means half, Kati means waist, Chakra means wheel, Asana means posture. So half waist posture. Okay? Yeah. All of you please stand. Legs together. While doing standing asanas, don't close your eyes. Now, let us do with our right side. So, let your left hand remain by the side of the body. Inhale and raise your right hand. Turn your palms upward. Inhale further. Exhale and bend your body towards the lateral side. Your body should bend like an arch. Do normal breathing. Don't bend your knees. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Inhale and slowly come. Palms upward. Further inhale. Let the hands touch your ears. Exhale and bend towards the right. Don't bend your knees. 1. Normal breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Inhale and come up. Exhale and relax. See, you see, while doing this asana, what are happening in your body? While doing this Ardha Kati Chakrasana, see, your thoracic muscles are relaxing and your lung capacity is increasing and you can inhale more of oxygen and exhale carbon dioxide. Similarly, you are stretching your vertebrae towards the lateral side. So it improves the flexibility of the vertebrae, nerves, muscles, and also it massages your abdomen and also the waist, so it reduces fat in the hip region. So it is really a very good asana. Anybody can do it. I think there is no contraindication for this except for recent surgeries. It's very mild asana. Okay, so with this we have completed standing asanas. Now let us do sitting asana. For sitting asana, Dandasana is the starting pose. So all of you sit and just shake your legs. I'll teach you a beautiful asana now. It is none other than our beloved Paschima Tanasana. Paschima means posterior, Tana means stretch, Asana means posture. Paschima Tanasana means complete back stretch. It stretches your body completely from head to foot. So now let us do this Paschima Tanasana. Inhale. Raise your both hands up to the shoulder level. Turn your palms facing the sky. Further inhale. Now exhale and bend from your lower back. Try to touch your great toes with your fingers. If possible, you can touch your knee joints with your forehead. Now normal breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Inhale, come forward. Exhale and bring your hands down. See, this is very, very, very important asana for all. But for ladies, it is really good because it makes them slim and trim. Those who are doing Paschima Tanasana, even they are eligible to go for a beauty contest. Such a good asana. Another important feature of this asana is it increases the height for the adolescents. If anyone wants to increase their height further, if they do Paschima Tanasana daily, it increases their height even up to 2 inches. I have found this. It is not a joke. It is the real thing. Now, the Paschima Tanasana, it actually stretches all the spines. It straightens our spines. It relaxes all our muscles, tendons, ligaments in our body. At the posterior side, similarly, the anterior side, that is in the front side, it actually massages all our abdomen organs. So it is good for diabetes. It stimulates the pancreas to secrete normal amount of insulin. It is good for fatty liver. It tones up the liver. It is good for our stomach. So it cures all sort of acidity and all. Even it is good for constipation. And those who are developing cramps in their calves, thighs, it is very good exercise and it covers the whole body. Okay, so now let us do this wonderful asana. Actually, it will make us become more beautiful, both physically and mentally, because it gives us some sort of humility. At the same time, it gives us confidence also. Okay, now let us do the Paschima Tanasana once again. your legs together. Inhale and raise your arms, palms facing up. Further inhale, exhale and come forward. Try to touch your great toes with your fingers. Your foreheads can touch your knee if possible. Now, adapt normal breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Inhale and come up slowly. Exhale and bring your hands down. So don't forget, this is the wonderful asana. If you do this, if you see from above, as if the hairpin is there. So it's such a good asana. So இது உடம்பு வளையாத உடம்பெல்லாம் வளையும், வேலை செய்யாத உடம்பெல்லாம் வேலை செய்ய வைக்கும். Such a good asana. Okay, now the complementary asana for this is Ushtrasana. See, the meaning of Ushtra means camel. Now, all of you please adapt Dandasana. Now from Dandasana, you bend your right leg, you bend your left leg. Adapt Vajrasana pose, try to sit on your heel. Vajrasana is the only asana you can do immediately after meals, because if you do Vajrasana, it actually improves blood supply to your stomach and intestines. So your digestion will be good and assimilation will be good. It is very good for obesity, diabetes, peptic ulcer, gastritis, constipation and what not. Okay, now you slowly raise your hands. Inhale and try to touch your heel. Again, with your left hand, you try to touch your left heel. Do normal breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Inhale and come up. Exhale and sit down. See, this is one of the beautiful asana. It is giving complete back stretch. It is important asana for COVID also, because while bending backward, it actually stretches all the intercostal muscles and also the muscles in the lung. So the space inside the lungs are increased, so you can inhale more amount of oxygen and exhale more of carbon dioxide. You just imagine, now we are actually running behind the oxygen concentrators and oxygen cylinders. But whatever it is, even I can give you 50 liters of oxygen or 20 liters of oxygen, but you have to inhale. So for that, your lungs and the respiratory system must work properly. So that you have to do. So if you do these kind of asanas, really it will be useful, and it actually boosts our immunity by increasing our oxygen level and also increasing our blood flow to all the cells, tissues, organs, systems of the body. Simultaneously, it eliminates more of waste and carbon dioxide from our body. So the next one is very rare asana, Gomukhasana. Gomukhasana, Go means cow, Mukha means face, Asana means posture. So this asana with the cow's face posture. So all of you, first Dandasana, bend your right leg, bend your left leg, both your knees should be at the same place. Now bring your right hand up and the left hand down and try to interlock your both the fingers and enjoy the stretch. It is very good. Be in this pose with normal breathing. It is very good for cervical spondylosis, frozen shoulder, problems with the wrist, fingers. It tones up your upper part of the vertebrae, cervical vertebrae, lumbar vertebrae. It stretches intercostal muscles. So it is good for all the systems of our body. Okay? So now release your fingers and stretch your legs. Now do it with the other leg, because all the symmetrical poses are If you do it on the right side, left side, if you do it on the left side, it is a counter pose. Okay, now you bend your right leg, then bend your left leg. So the which knee is up, that hand should be up. So like that, you can. Try to interlock your fingers. Suppose if it is not possible for you to interlock, you can use rope. This technique was given by Dr. B.K. Iyengar. So you can use rope for sometimes those who are having cervical spondylosis or shoulder problems, they cannot interlock. Or some people, they can interlock right side, but left side they cannot. Okay? Be in this position. Now release your hands and come out. So with this, we have completed the sitting asanas. Now, all of you lie down on your stomach. Lie down on your stomach, hands together. Keep your hands like this and lie down. This is called as Makarasana. This is one of the relaxing asana. Anyone can use it. Even watching television also, you can lie down on this. It gives you complete relaxation. Those who are having high blood pressure, heart problems, it is really good for them. And this is the starting pose for all the prone asanas. Okay? Now let's do Bhujangasana or Cobra pose. Keep your palms at the shoulder level. Inhale and raise your upper part of the chest. Your elbow should be bent. Now normal breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Exhale and come to the pose. See, this Bhujangasana is really good. See, it stretches our thyroid, parathyroid gland. It tones up our neck muscles. It tones up our heart, lungs, all the thoracic cage, and it improves our breathing capacity. Our lung capacity is again increasing. Okay? Now let us do Shalabhasana. Shalabha means locust. Asana means posture. Locust posture. So all of you first lie down in Makarasana. Make your hands as a fist and keep both your hands under the groin. Keep your chin down on the floor. Inhale and raise both your legs. Normal breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Exhale and come down. Relax. Those who cannot raise both the legs, they can raise one leg like this. It is known as Ardha Shalabhasana. Ardha Shalabhasana. Okay? Then after doing Ardha Shalabhasana for sometimes, you can do Purva Shalabhasana. So the Shalabhasana, actually, the contraindications are those who are having lumbar spondylosis, disc prolapse, they should not do this. And those who have undergone a recent surgery in the abdomen also, they should not do this. But this Shalabhasana is really very important because Bhujangasana, it takes care of your upper part of the body. This Shalabhasana takes care of your lower part of the body. So it is really good. It is good for varicose veins, that is calcaneal spur, arthritis, hip pain, low back pain. It is very good. Now let us go for the last pose in the prone position. It is Dhanurasana. Dhanu means bow, bow pose. So first all of you lie down in Makarasana. Bend both your legs. Try to catch your right ankle with your right hand, left ankle with your left hand. Inhale and raise your body. You can even do walking movement. You can enjoy. You can do walking movements forward and backward. It's the complete asana. I have to write a book to explain the uses of this asana. So it completely tones up your bones, muscles, nerves throughout the body. Now, bring your legs down and relax. This Dhanurasana is excellent for lifestyle disorders like diabetes, obesity, and dull-headedness, anxiety, depression, loss of interest in life. All this very good. So now let us do once again the Dhanurasana. Bend both your legs. Try to catch both the ankles with your both hands. Inhale and raise your body. Do normal breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now exhale and relax. See, all of you please lie down in Savasana. I am going to teach you 3 important asanas. So now let us do the Pavanamuktasana. Pavanamuktasana is both asana and kriya. Pavana means air, mukta means release, asana means posture. This posture will release unwanted accumulation of gas, waste products. So apana is the eliminating volume in our body. This Pavanamuktasana acts on apana and it cures n number of problems. Okay? So keep your legs together. Bend your legs. Exit now. Exhale and bend both your knees up to your chest and interlock your knees with the fingers. Up to this you have to do exhalation. Now inhale and raise your head and touch. And try to touch your knees with your chin. It is exactly opposite to Dhanurasana we are doing. Be in this pose. 1, 2, 3, 4, 5. Slowly bring your head down. Release your hands and stretch your legs. Very, very, very important asana to be done in the morning. There are so many variations and so many series in this. Due to time constraint, I'm checking on this. Those who cannot bend both your knees, you can do Ardha Pavanamuktasana. Like this, you can do. First, you can bend your knee, and with the exhalation, you can touch your knee with your chest. You can inhale and try to touch your chin with your knee. And again, you can do it on the left side. Bend your knee, exhale and try to touch knee with your chest. Inhale and try to touch the chin with your knee. Beautiful asana in the supine posture. Next, very simple one for elderly people. They can simply raise their legs. This is called as Uttana Padasana. This Uttana Padasana is very good for piles, varicose veins, and excessive weight in the thighs. It is really a good asana. Now from this Uttana Padasana, we can go to Sarvangasana. Sarvangasana is known as the queen of asanas. ஆசனங்களின் ராணி என்று இதை கூறுவோம். இது நம்மை உடலளவிலும் மனத்தளவிலும் அழகாக்கி பராக்கிரமசாலியாக்கிவிடும். So let us try this. Slowly raise your hip. Support your hip. It is also called as shoulder stand. See, while doing this, you have to inhale, and when you come to the final position, you can do the normal breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Slowly hold your legs, bring your legs down and relax. See, all the parts in your body is activated, toned up, massaged by this. So don't worry, with practice you all can do. So now, all of you raise your foot up to 90 degrees. Slowly raise your hip and try to keep your hands on the hip and slowly raise your body while inhaling. You try to support your whole body with your shoulders. Normal breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Exhale and slowly relax. This is the beautiful asana. I find it very difficult to learn this. But one of the yoga professors, she trained me for 15 days with a great belief on me. So don't worry, you all can do at any age. Now let us do Chakrasana, that is complete wheel pose. You can roll your body like a wheel, but if you know the technique, you can do it easily. So all of you lie down, bend your legs, keep your palms on the floor, inhale and try to raise your body. 1, normal breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Exhale and slowly relax. First, bring your head down, next chest down, low back down, and then next. See, it is one of the advanced asana. But if you have strong love and affection and perseverance, definitely you can do, because Patanjali says, Abhyasa Vairagabhyam Tanniyodaha. Abhyasam means practice, Vairagyam means perseverance. So if you have the desire to practice with the perseverance, nothing is impossible for you. Let's do it once again. Fold both your legs. Keep your palms down. Inhale and raise your body slowly. 1, normal breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Exhale and slowly bring your head down, chest down, lower back down, keep down and stretch your legs and relax for a few seconds. Now let us proceed to pranayama. Pranayama is not breathing exercise. Pranayama is the breath control practices. Prana means breath, ayama means expansion. See, why we are getting COVID and all? You see, elephant and tortoise, they are living for a long time. But animals like dogs, they breathe. So shallow and rapid breathing. But if you see the tortoise, it takes only 1 or 2 breaths in a minute. So the normal breath now, we humans only take 13 to 14. It is normal. Suppose if you breathe 20, 30 like that, your lifetime will be reduced. So if you breathe more and shallow, your lifetime will be reduced. If you breathe deep and if you try to reduce the breath rate, see, yoga is the only thing which can control even on the autonomic functions of our body. Breathing, then beating of the heart, kidney functions. So everything, these are all autonomic. They are doing automatically. But with the yoga, even you can control the breathing. So that is the beauty of pranayama. So now let us do Nadi Shuddhi pranayama. Nadi means that they are the subtle tubes which are flowing throughout our body. They only carry prana and supplies this prana shakti throughout the body. There may be some block in the nadis, or there may be excess of prana or deficiency in prana. So if you do this nadi shuddhi, you are actually correcting and you are balancing this. So all of you please sit in Padmasan or Vajrasan or Sukhasan. Left hand Chin Mudra, right hand Nasika Mudra or Vishnu Mudra. First I will tell the procedure, you can repeat it. This is also called as alternate nostril breathing. You just imagine inverted V. Inhale through the left nostril, close it. Exhale through the right nostril. Again inhale through the right nostril, close the right nostril, and exhale through the left nostril. This is one round. See, this is the beautiful pranayama. It has everything. It's a balancing pranayama. Also, you can do it anytime, anywhere. Okay, let's start. All of you sit in Padmasan, Sukhasana, or Vajrasan. Left hand Chin Mudra, right hand Nasika Mudra. Close your right nostril. Inhale through the left. Close it. Exhale through the right. Inhale through the right. Close it. Exhale through the left. Let us do two of the rounds. Inhale. Close the left. Exhale through the right. Inhale. Close the right. Exhale through the left. Inhale. Close the left. Exhale through the right. Inhale. Close the right. And exhale through the left. Now I will give you command. You can do it. Inhale through the left. Close the left. Exhale through the right. Inhale through the right. Close the right. And exhale through the left. Once more. Inhale through the left nostril. Close the left nostril. Exhale through the left nostril. Inhale through the left nostril. Right nostril. Close the right. Exhale through the left. Inhale through the left. Close. Exhale through the right. Inhale through the right. Close. And exhale through the left. So this is called as Nadi Shuddhi Pranayama. This really did wonders for my COVID patients. It worked as both preventive and curative. Okay, next let us go for Kapalabhati. What do you mean by the word Kapalabhati Pranayama? Kapala means skull, Bhati means shining. இப்போ நம்ம எப்படி வந்து பாத்திரம்லாம் தேய்ச்சா பளபளன்னு அதோ அந்த மாதிரி this Kapalabhati Pranayama will wash your brain cells and keep it shining. See, the technique is you have to do passive inhalation and do multiple forcible exhalations. I will do sit in Padmasana or Vajrasan. Keep your both hands in Chin Mudra. Inhale slowly and exhale forcibly multiple times. Like this. See, this Kapalabhati, those who should not do, those who are having high blood pressure, heart problems, and those who are having severe acidity problems, because this Kapalabhati is activating pranayama, so sometimes it may increase the gastric juice in the stomach. Okay, so these are all the contraindications for Kapalabhati, but the uses are, it is very, 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 very good for diabetes mellitus. If anybody is having uncontrolled diabetes, kindly do this. See, one cycle consists of 10 rounds. So actually I can do forcible exhalation 120 blast also without any break. By practice you can do that. At least morning you can do 3 times like that. So first you do with the 5 counts, then you can increase with 10 counts like that. So let us all do this Kapalabhati with 5 counts. So all of you sit. Keep both your hands in Chin Mudra. Do passive inhalation. Forcible exhalation only 5 times. While forcible exhalation, your abdomen should flap. So that is the technique. Let us do it once more. Inhale. Like this you have to do. This is known as Kapalabhati. So this is activating pranayama. Nadi Shuddhi is balancing pranayama. Next is Bastrika. Bastrika means the blacksmith. You know the blacksmith, how he works. So like that. So all of you sit and close your hands and make a fist. Inhale, Raise and free your palms. Exhale and bring your hands down and make a fist. Again, inhale, exhale. Inhale, exhale. Inhale, exhale. Come on, let us do it. Bhastika. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. See, the contraindication for Bhastika is those who are having high BP and cardiac problems, that's all. And those who have undergone recent surgery in the shoulder or elbow or hands, that's all. See, this Bhastika pranayama, actually, it will elevate your mood level. It increases oxygen supply. It is really very, very, very good for COVID. And this Kapalabhati and Bhastika, it will make your morning yours. It will make you more active, more positive thinking. It removes all sort of negative energy. So now let us do cooling pranayama. See, we have activated your body, so we have to cool our body. So now let us do the cooling pranayama. It is called a Shitali pranayama. You know all Shita means cool, cooling pranayama. So first pranayama is you have to stretch your tongue and make it like a bird's beak. And you have to inhale. Retract your tongue back and exhale. See, the principle in the refrigerator is when the air is passed through the narrow tube, it is getting cool. So the simple technique we are using. See, this Shitali pranayama is very, very, very good for cervical spondylosis. I have given this pranayama to all my patients. Even before going out of my clinic, they felt a lot of improvement in their neck pain. Those who are unable to turn their head also, they can easily turn. So actually it relaxes all the contracted neck muscles, it removes stiffness, and it gives you some sort of tranquility and happiness and some sort of, happy feeling. Okay, so now let us do it. Keep both your hands in Chin Mudra. Make your, stretch out your tongue and make it as a bird's beak. Inhale. Close your mouth and exhale. So do it. Here you are inhaling through your mouth and exhaling through your nose. You may ask one question. Ma'am, I am unable to fold my tongue. What to do? Don't worry. Sadanta is there. See, Danta means teeth. See, all of you, close your teeth like this. Let your lips be open. Inhale the air. Close your mouth and exhale. This is Sadanta. Let us all do this Sadanta also. Keep your hands in Chin Mudra. Inhale. Exhale. Inhale. Exhale. See, it may look somewhat awkward, but it is for the best. See, what is the beauty of this Sadanta? If you have some sort of tingling sensation or pali kucham solo. So, if you have too much of sensitivity in your teeth, this is the beautiful pranayama. You need not spend money for Sensodyne. Sensodyne toothpaste is very costly. But with this, what is the contraindication for this? Those who are having severe toothache or some sort of infection in the mouth, they should not do that. And now, most important pranayama is the Brahmari pranayama. Brahmara means honey bee. See, this Brahmari pranayama is very important for ENT. Those who are singing, those who are speaking for a long time, see, this pranayama is good for singers, teachers, musicians, and those who are preaching. It is good, and even it is good for us also, because most of the time we are talking only. It will take care of your ear, nose, throat. All the five senses will be aware of what is happening around you. So I'll give you the technique. So all of you, please sit down. Padmasana or Vajrasana or Sukhasana. Close your ears with your index finger. Close your eyes. Inhale. And make the sound. You can see the vibration in your entire skull. and your throat will be toned up, ears, nose, everything will be toned up. Let us do it once more. Close your ears with both your index finger. Inhale. Make honeybee sound. Again, inhale. Make sound. Making of this honeybee sound will become exhalation. So this is something about pranayama. Now all of you lie down in savasana. I'll give you one guided body meditation. It is also known as body scan. All of you please lie down, legs apart, hands apart, close your eyes. You have done good amount of breathing exercises, loosening exercises, asana, standing, sitting, prone and supine asanas, and you did good amount of pranayama also today. So there is a good blood supply throughout your body and you are getting good amount of oxygen and simultaneously you are removing all your waste and carbon dioxide. Now you focus your attention on the right great toe. It is relaxing, it is enjoying, and focus your attention on all the toes in your right foot, your ankle joint, your right foot. It is relaxing. Now you shift your attention to your left great toe, all the other toes, your foot. See, our foot is very important. Without that, we cannot move. See, it is having so many tiny muscles, tiny bones. See, we are spending money for chappals, but we have to take care of our food, right? Next, you focus your attention on your right ankle and then your left ankle. They are relaxing nicely. See, in Tamil we can say, Udale, Aradikire. So this is how we can take care of our body. Now you focus your attention on your right leg. It is relaxing. It is having calf muscles, two bones, tibia and fibula. You shift your attention on your left leg. Calf muscles are relaxing, all the bones are relaxing. Now you shift your attention to your right knee joint and left knee joint. So this is the major weight bearing joint in our body. That is why we are getting knee joint pain and arthritis and we are spending so much of money for knee joint replacement and again revision surgeries. So you please concentrate and give importance to your knee joints. It is now relaxing and getting good blood supply. And it is toning up. Now both your thighs are relaxing. See, your thighs is having good quadriceps muscles. It is relaxing and it is toned up. All the blood vessels, the sciatic nerve is relaxing. And now you shift your attention on your right hip, lower abdomen, left hip. All are relaxing. All your urethral organs, genital organs, rectum, anus, all are relaxing. Your lower back is relaxing. And shift your focus on the upper abdomen. See, your liver is relaxing. It is working throughout. Your stomach is relaxing. See, during COVID time, we are eating without our knowledge. And your spleen is increasing. Your pancreas is relaxing. The pancreas, it is helpful for our digestion and it is maintaining our blood level in our body, blood glucose level in our body. It is relaxing. And all the small intestines, large intestines are relaxing. Now you shift your attention to your chest. See, your heart and lungs are covered by the beautiful chest cage, water protection given by God. So, see your heart, it is working throughout 24/7 without any break. It is actually relaxing. The heart itself is getting more amount of blood supply. It's a beauty, no? And the lung itself is getting more of oxygen. It is relaxing. Now you shift your attention to right shoulder, left shoulder, right arm, right elbow, right forearm, right wrist, and all your finger and see. In Tamil, we can say, Ulaikum kaigale, ennai uruvaakum kaigale. Now we are giving rest to your hands, they are all relaxing. Similarly, you focus your attention on the left side, left shoulder, left arm, left elbow, left forearm, left wrist joint, and all the fingers. See, now you have started worshipping your body. Now you shift your attention on your neck, front part of the neck, sides of the neck, back of the neck. It is relaxing. Your thyroid gland is relaxing. Your parathyroid is relaxing. All your endocrine glands are relaxing. And now you shift your attention to your face. Your forehead is relaxing. Your eyelashes are relaxing. Eyelids, upper eyelid, lower eyelid, eyeball, optical nerve, all are relaxing. See, both your nostrils, your nasal muscles are relaxing. Both your ears are relaxing. Your upper lip, lower lip, 32 teeth, your tongue, which is caught in between all the 32 teeth, but it is very careful. So it is relaxing, upper palate, hard palate, throat, all are relaxing. And finally, your top of the head, the vertex is relaxing. Now you are feeling the good amount of blood flow from your great toe to the legs, your abdomen, thorax, neck, hands, and finally to the head. And from top of the head to the neck, upper arms, chest, abdomen, thighs, legs, and up to the toes. You enjoy this vibration, sensation, and feeling the day is yours. Be in this state for 1 or 2 seconds. Now, you bend your left leg, turn your body to the right, keep your right hand under your head, support your left hand on the floor, and slowly get up. Slowly get up. Don't open your eyes. You rub your palms 10 times. Keep your palms over the eyes. Think of your parents. Because of them you have come to this earth. Think of your beloved teachers, professors. Think of your friends, well-wishers. Think of even your enemies and those who didn't like you. Even pray for their welfare also. And you please rub your palms against your face, neck, shoulders, chest, abdomen, and throughout your body. And now see your hand and say this prayer. Karagre vasate Lakshmihi Karamadhye Saraswati Karamule to Govinda Prabhate Karadarshanam. I didn't have time to go to temple and all. When you get up in the morning, you just see your hand. See at the tip of your hand, Lakshmi is residing. Center of your palm, Lord Saraswati is residing. At the end, at the edge of your palm, Lord Vishnu is residing. So please open your eyes and have a great day, fantastic day. Thank you very much for this golden opportunity to be with you. Hope this will be of little useful to you all. Thank you. I might.
Thank you very much, ma'am.
Any doubts or queries? I can ask.